Hi everyone, I'm Dr. Russ from Islands Pediatric Dentistry in Gilbert. I have Miss Rebecca here with me, who's 6, and she's having her moderate anterior tongue tie treated today. She also brought her 2 sisters with her. Both were severe tongue ties, and we have already treated both of them earlier today. So we're treating the last sister, and she's so cooperative and so mature, so we decided we're going to do a video to show everyone what the tongue tie issue for her is and how we're gonna treat it. Yes, baby, how you feeling? You feeling okay, baby? Yes? You want to say anything? You want to say hi to the camera? No. Can you open big for me, my love? I look inside for you. Thank you. Stick your tongue out for me, sweetheart. Can I look at your tongue? Open big. Ah. Pull the lower down for me. Awesome. If we look under, we see how this attachment for her is moderate, not this most severe kind, but it's attaching more or less to the tip of the tongue, not to the base. Can you stick one more time for me, baby girl? Thank you. We can see how, stick it out one more time, sweetheart. As soon as she sticks it out, the tip of the tongue curls in, meaning that it doesn't have the range of motion or freedom to go out all the way. And the way we tell is we fork it on each side with our index fingers, and we try to elevate the tongue to the roof of the mouth. You're doing so amazing, you know that? I love you, baby. You're doing excellent. So we try to reach it to the top of the roof of the mouth, and we clearly see that this attachment is tight. Now, Rebecca wasn't having a whole lot of speech issues, but both sisters were, and we're going to have Mom explain to us what those symptoms were. But Mom decided that if other 2 kids are going to have it done and treated, she didn't want Rebecca to suffer from any symptoms that we may not know about, including sleep apnea symptoms, even down the road. May I have one more topical for her? Sweetie, I have my Princess Jelly that I'm putting on your tongue. This is the one that's going to make your tongue fall asleep, okay? So if we pay attention and listen closely, we can sometimes even hear our tongue snore when it falls asleep. Did you know that? Sometimes your tongue gets so sleepy that it makes these silly noises. Do you ever snore when you're sleeping, Rebecca?
Uh-huh.
You do? How about Mommy? Does Mommy snore?
Mm-hmm.
Uh-oh. And my mommy snores too. My daddy snores really loud. Can you open big one more time, baby? Don't swallow. Let me wipe this for you, honey, okay? Yeah, my daddy's like a choo-choo train when he's sleeping. Stick your tongue out one more time, baby. Good girl. Good girl. Just like that. Just like that. Let's get a saliva ejector for her. A little bit of water. Don't swallow, my baby. Thank you, sweetheart. Excellent. Excellent. Keep breathing with your nose, baby, okay? If you and I keep breathing with our nose, like when we're taking big sniffs, when Mommy cooks bakes some cookies and you want to smell them, like, can you show me how you do that? I love it. Good job. Yes, excellent. Remember, if I do anything that hurts you, you raise this hand for me, okay? So I know when I stop. Now, Bernice is going to spray some water on your tongue. Can you open big one more time? There's going to be some water, so you keep breathing with your nose, my love, okay? Thank you, thank you. Good job, good job. Bernice, go ahead and wash all that yucky stuff out for her, baby.
Oh, yeah.
Thank you, thank you. Let's get that water out one more time. La 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 la. La 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 la. Good job, my baby. You did so excellent, so excellent. Very nice, very nice. Can you open again one more time, my sweetie?
Open the baby door.
Excellent job, Rebecca. We gotta make sure she gets an extra prize today, okay? Because not only she's a great helper, she's also helping us with our video today. Oh my goodness. Yes? You know, after we're done, we're gonna get you on Auto Pop. Do you know what color you would like? I have purple one, green, orange, blue, red. Which one would you like? You can tell me later. You decide after. Sounds good. You know what? Now that we're waiting for a minute for the numbing to take effect, I would love for you, Mom, to share what symptoms the other 2 ladies were having.
Yeah.
You know?
Yeah, so
All 3 of my kids we adopted through foster care, and so I wasn't there when they were born to, have a discussion about the tongue tie. We've had several speech analysis, tons of speech therapy, working on the S's, the R's, the TH's, and Dr. Rez is the first dentist that has actually asked me about the tongue tie. We looked into it a little bit more, and it just makes sense. I would rather fix, the issue than keep, going through so much speech therapy.
And your other 2 daughters have been in speech therapy for how long?
Yeah, the youngest has been in speech therapy for 3 years. She had a significant speech delay. and then the oldest has been in for about a year and a half. So this is hopefully going to be really,
Again,
really
this is
helpful.
so easily missed and
Yeah.
so easily treated. Now the other two ladies, Rebecca's older and younger sister, we just treated within the last hour, and they're just chilling watching the movie in the other room. And you decided that even though you were not having any speech delays with Rebecca, and hers was slightly more mild than the other two sisters, you still wanted to treat it. And sometimes parents decide that. I usually like to only release it if there's super severe or has to be a symptom of some kind. Right. But when parents ask me, hey, you know, my child has a moderate tongue tie, would it hurt if I released it anyways? The answer is no, but I don't want to be super aggressive game planning them.
Well,
but when you're up for it, it completely makes sense to me, so I'm happy for that.
And she's having the same trouble with her S's and her R's and her THs.
Oh, is that
she's
right?
Just not currently in therapy. But we can hear it. We can tell it
and
will
you know,
help.
the beauty of it is you give it 3 months and you're going to notice a significant difference. So I'm very excited about that happening. Now, Rebecca, baby, I have my little flashlight that has a red light on it. Do you see that, sweetheart? That's the one I'm going to shine on your tongue. Do you see this, baby? Do you want to hold it? Would you like to grab it? It's my little flashlight. I'm going to shine it on your tongue. It's going to make that red light show up on your tongue, okay? It's going to make a beeping noise, and it's going to feel a little warm. It's not supposed to be burning or hurting. If I do anything that hurts you or burns you, you raise this left hand for me so I can see and I stop for you, okay? Can you remember that, honey? Awesome. Can you open big for me, sweetheart? Excellent. Open big like an alligator. Let's retract that lower lip for her. Yes, yes, yes. Thank you, sweetie. Thank you, my baby. Good job. You stay like that. Keep breathing with your nose. So, you see how hidden it is? Unless I go fork on the sides or use my tongue retractor, then you don't see it. And if you don't ask the questions, you definitely miss it. So here we go, guys. La, 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 la. Good job, my baby. Keep breathing with your nose, love, okay? You're doing so excellent. The little red area we see here is from my local anesthesia I gave her earlier. The beauty of the laser is really how quickly it's done. Very little discomfort, if any, and the fact that there's no bleeding and everything is cauterized so nicely. Now we just see a little bit of red stuff from our local anesthesia. You doing okay, baby?
Yeah.
Awesome. We're almost finished here, okay? Could you stick your tongue out? Can I see your tongue one more time? See how much release we have already? Yeah, we got to go more on the sides for her. Very commonly, providers are not releasing wide enough based on what I'm learning from Dr. Gahari, who's an ENT, who's the leading expert in treating the tongue ties. You okay, baby?
Uh-huh.
So very often, our providers are not releasing based on what I'm learning from him. We're not releasing wide enough or posteriorly enough, or if you will, to the back or on the sides enough. So very often, we're only releasing in the middle, and that just doesn't get it done. It doesn't give him the full release. You okay, sweetheart? Is something hurting you, honey?
No.
Okay, you're moving your head a little bit. It makes it hard for me to shine my light on your tongue. Do you think you can keep breathing with your nose and hold still for a minute? You're doing such an excellent job. I love you so much. You're doing so good.
You're doing great.
Isn't she? Can you open big one more time? Awesome. Very nice. You don't have to stick your tongue out anymore, okay? I know your tongue feels different, but stay open for me, baby. It's actually right in the middle for me. Put a little bit of pressure if there's any local anesthesia is there, come out. Perfect. Thank you, Bernice. Good job. We're almost finished here, my love. La, 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 la. Good job, Pumpkin. Beautiful. Good job, my baby. You're doing excellent. We're almost finished here. We're just fine-tuning, making sure everything is perfect for you, okay? A little more in the middle, and I'm eager to see how what my mobility is now on this tongue. Could you stick your tongue out again, sweetheart? Can you show me again? La la la. Stick your tongue out again, baby. And I'm going to lift it up and see where I'm tied again. So I can see the muscle underneath, which looks beautiful. I have a little bit of a sheath here. I might clean that. And you know she's so juicy, that's why it's taking a little longer. She has a lot of saliva, and I numbed her pretty good. So that's mixed together. The fluid makes it, the liquid makes it go a little slower here. And we want to be patient and be very gentle, because we got some nerves and blood vessels down here we're trying to dance around. That's our lingual nerve right there. We want to stay away from that guy. Da da da. And then we have a lingual artery right underneath of that. Perfect. You see how far back I'm going with her to make sure that every time she sticks her tongue out, you can see how the corners of the release are still restricting her tongue movement. And we know we're going to lose some of the release perhaps because of the quick healing. So I want to make sure we do our best as far as releasing fully. And of course the instructions from mom as far as how to massage the wound to prevent it from reattaching is going to be very important here. Stick your tongue out one more time for me, baby girl. Thank you, sweetheart. You did so amazing. I'm so happy with how this turned out. You did really good. She looks really good. I'm happy with this. Awesome, awesome. Let's see how much more mobility we have now. Put the lower lip down for me, would you please? Thank you. So now we can see we have more mobility. What's restricting it now is the muscle in the middle. Now the muscle will stretch, so I have no concerns with that. There's no reason to cut any further. The muscle would stretch, but the fibers that the frenum has, the collagen 1 fibers don't stretch. That's why we have to cut it to get the release. She looks beautiful. I'm very happy with how it turned out. Thank you.